everybody, this is Jamarcus here. Listen, I just wanted to come on and just do a short video, and I wanted to talk about the lab kit that each of you will receive. So I came up with a lab kit to send to each one of your houses so that we can complete the skills at home. And so I just wanted to go over some of the contents that you'll receive from the lab kit. Once you get this lab kit, you can feel free to look through them. Just make sure that you keep up with the contents, if they're in Ziploc bags or not. So when we get to that particular skill, you wouldn't be trying to find it or possibly losing it. So let's go over this kit and we'll keep it moving. So when you receive your lab kit, one of the first things that you will find is a PPE kit, personal protection equipment. And so in this bag, you will find a non-surgical mask. Okay, you will find this yellow material is an isolation gown. You'll find a cap, and then you'll also find shoe covers to cover your shoes. And so when we start talking about infection control and PPE, we'll use our PPE kit to go with those matters. Next thing, let's see what this is. You'll receive, this is for phlebotomy. And so with phlebotomy, you're going to receive that lab bag. This will be your lab requisition bag. Okay, so in this bag, when you look at the contents, you're going to have your 5 collection tubes, and I may send more home with you, just so you can practice once we get to the phlebotomy portion of it. But you'll have your collection tubes. So when we start talking about the order of draw, you will have these to use. And I'm also going to be sending home to you guys a order of draw card, which will have the phlebotomy order of draw, the certain additives that's in those collection tubes. As you can see, like this one has an additive, but some of them have clear liquid and then some are just empty. And so you'll get a card that talks about each of those additives. You'll get some ChloraPrep to cleanse the skin. Butterfly needles, this is just to collect the blood. You'll get Vacutainers. These bottles right here, these are called blood culture bottles, and these is what we do when we collect blood, and we're going to talk about these. We're actually going to practice this as well. Let's see. You got your tourniquet, another Vacutainer, alcohol prep pads, and some gauze. And so when we talk about the phlebotomy portion, you'll have everything you need to do phlebotomy. Also, I'm giving each of you guys, or I'm going to give each of you guys some gloves. These gloves are all sizes from small to extra large. So I made sure I packed enough in there for you to use. Again, when we talk about infection control, hand washing, PPE, we're going to always be using gloves. These gloves are nitrile gloves. They are not latex. For any of you who are allergic to latex or might be allergic, these are fine because these are powder free and they're nitrile. Okay, let's see. Okay, next, surgery procedures. And so when we talk about surgery procedures, I have made all these contents that's in this bag, this Ziploc bag, to do a surgery procedure. The type of surgery procedure that I am going to mention in class is the suture removal and the staple removal procedure. So in your bag, you're going to receive some Practi, let me see if my, okay, you're going to see some Practi skin. So as you can see, this has staples, it has stitches, and we're going to be practicing the correct way how to remove stitches and sutures. So you're going to receive that. You're going to receive some povidone iodine. You're going to use a general purpose tray. This is also called a suture removal tray. And these are instruments that are used to remove those sutures. Let's see, we got some steri strips to close up the wound, some alcohol prep pads, and then I also have a staple removal utensil. So you'll receive all that in your bag when we begin talking about surgery procedures. All right. Let's see what's next. Okay. This next bag that you will receive that will be in your kit, this is surgical gloves. Okay, so when we start teaching about sterile gloving, we're going to be using these gloves, not these regular, not these regular gloves. We're going to be using surgical gloves. Now, with all surgical gloves, they are latex, and so again, if you are allergic, just remain cautioned that this is latex gloves. So when we talk about sterile gloving, those sterile gloves will be in there. Let's see. All right, we're going to talk about point of care testing. We're going to talk about fecal testing. We're talking about urine testing. And so in this bag, you're going to receive a urine collection cup. This urine collection cup will be there. You're going to receive some urine chem strips, which are these right here. Let me see if I can get closer. Maybe. I'm trying to get the light. These have different colors on there. But that's a urine chem strip. And then also in this bag, I have included a hemocoat card. This is a card that we use to collect stool matter. Okay, we're looking for blood in the stool, and so we'll use this card to test that. And so this will be in there. I also have some syringes, and I have a spatula stick that you will use, and this will be all for our collection procedures. Okay, you're also going to receive a Bacti swab, excuse me. This is it. And when we start talking about wounds and wound cultures, I'm going to let you guys use this to do that wound collection. This Bacti swab, we can also do this for COVID-19 testing. So you may have seen these if you ever got a COVID test. These are the swabs that we use. Okay. I'm also going to be sending you guys home with a vision acuity chart. Okay, so you will find this. We have to practice this when we talk about vision acuity. You have to practice on some type of family member, and you're going to be testing their vision, making sure that they stand 20 feet apart, and then you are performing the screening. So you will receive that vision acuity screen in the mail. With that being said, you may receive a kindergarten chart. So if you do, or if you're one of the people that receive a kindergarten chart for children, then you'll be practicing your vision screening with children. All right. Okay. This right here, let's scoot up. This right here, let's see if my light will show. Okay. This is an injection pad. So when we start talking about medication administration and we start talking about intramuscular injections, we're going to be using this pad to do that. And so this has Velcro attached to it. It can go around a thigh. It can wrap around a person's arm, just like so. And then you will use this to practice giving injections. So you don't have to practice doing it on real people, animals, or anything like that. So this will be in your kit as well. All right. I've also included this right here. These are OBGYN procedures. This is for the procedure for a pap smear, okay? So we've all, well, not all, if you're a male, but we have our surgical spatula. If you are a woman, you know exactly what this is. So we have our speculum. I have a pregnancy test in here, because we got to talk about pregnancy tests. And then I have things for the actual pap smear procedure. So all of that would be in there. Let's look at some more stuff. I got some more gloves. What this is for. Okay. Also, in your kit, you're going to be practicing performing rapid strep testing, rapid flu testing. And so in your kit, I have provided everything you need to perform a rapid strep test, okay? So with that being said, I have drawn up only enough developer for you to do one strep test. So make sure that if you are looking at this, that you don't waste it, because you're going to need it. So you're going to get a tongue applicator, or tongue depressor, excuse me, a syringe. You're going to get a, what's this right here? a cotton tip applicator to swab the throat. And then you're going to receive in those syringes a strep A and a strep B developer. And these are the developers used to determine if a test is positive or negative for strep. And so I'm going to send everything that you need in a Ziploc bag. So make sure that you keep up with this. So when we perform strep testing, you know exactly what to do. All right. Next, surgery procedures. This is more so about the surgical scrub. And so in this pack, we're going to talk about scrubbing for surgery. We're going to talk about, what is this? Povidone iodine when we cleanse the skin. And I'm going to use, this is a surgery wrap. We're also going to talk about how to wrap surgery instruments. And so when we get to that portion, I'm going to allow you to use this as your surgery wraps. We may keep our instruments that we use to remove sutures so we can go across this course as far as learning how to wrap instruments for surgery. We got some liquid povidone iodine. And so, yeah, you're going to receive everything for that surgery procedure. All right, next, everybody's going to receive a Barbie. You're going to receive a Barbie doll that's in your kit. This is a made-to-move Barbie, so she can be moved into any type of position. So I was able to find enough Barbies, made-to-move Barbies, to move in all different types of positions. One of the things that you must realize is that in healthcare, we teach on patient positioning. And so when we talk about patient positioning, even when we're charting, we don't say the patient laid on their back, the patient laid on their side, they lay on their stomach. And so when I start teaching you about patient positionings, you're going to be required to check off in front of me through the camera by putting the Barbie in positions. That would be a quiz, actually. And so, for example, if I told you to lay the Barbie in supine position, the Barbie would be lying flat on her back. If I told you to put the Barbie into lithotomy position, okay, she's gonna be in this type position. Okay, bring your leg up, girl. Okay. So that's the lithotomy position. This is the same position that you will be in, women, if you have children to give birth, or if you're getting a OBGYN procedure, you're going to be in this lithotomy position. If I said that she needed to be put in the lateral position, you will put her in the lateral position. Okay? Which will be on her side. Okay? Sims, Trendelenburg, reverse Trendelenburg. We'll do all of those. So that's what that Barbie's for. Hang on to those Barbies because that's what we're going to do when we practice patient positioning. All right. Medication administration. This is my favorite. I wanted to make sure that we mirror the real thing. So in your medication administration kit, I got some peel bottles. I also got you some. Right here. Oh no, it broke. All right. Okay, in your kit, you're going to receive Practi powder. Let me see where my camera's at, right here. Okay, this has powder in it. So when we practice medication administration, you're going to actually practice drawing up this medication in a syringe. And you got a vial, lidocaine, whatever you want to call it. And we're going to practice mixing a powdered medication and a liquid together. It's called reconstituting. Okay, you're also going to receive an ampule. An ampule is glass, and this is actually broken, but this is an ampule, and we're going to talk about how to safely break an ampule and then draw the medication out of it. So you're going to receive that. Be very careful because it is glass and it does break easily. So you'll receive those. We're going to practice how to draw out, again, those powdered medications as well as those liquid. Okay? I have also included Practi medications. So listen, because my students do this all the time, and I have to make this disclaimer. These medicines, let me say that, even though they may say morphine, metformin, these medications are not real, okay? They're placebos. They're fake medications, okay? Diazepam, okay? These are fake. Don't you give them to anybody. Don't you swallow them, okay? We don't want you to die. You probably won't die. I'm sure you won't. But if you take more of these, yeah, you probably will. So that's a disclaimer. These are fake medications. I'm over a program with a hospital, and I've actually had people steal these medications. All right. I got more things in this medication. I got needles. I got syringes. I got tongue depressors. Everything we need to do to practice injections. We talk about intramuscular injections, subcutaneous injections, intradermal injections, sublingual type of routes of medications. You have all that in your medication kit. So we have that. I got the powdered medication. Oh, here's something else. I got your medicine cup. We're going to practice pouring medicine. Also, I got you some transdermal patches. Okay, so you have these two. These are more so, this is a fentanyl patch. Again, this is not real fentanyl. Okay, this is a fake patch, but I want you to know and how to do almost the exact real thing. So those fentanyl patches are in there. So when we start talking about transdermal patches, I'm going to talk about the importance of how we should apply a package and how we should avoid touching it with our bare hands, because medication is transmitted through the transdermal membranes. So that looks like everything that will be. Also with phlebotomy, I'm going to send you guys home with a capping. In the hospitals, this is exactly what a phlebotomy tray looked like. And so you'll have this tray where you can actually assemble all of your phlebotomy accessories. It's so embarrassing if you're in the hospital trying to draw blood and you get to your patient's room and you don't have all your equipment. You don't have all your supplies. And so then you have to go all the way back down to the lab, gather your supplies, and then it's just wasting time. So we're going to talk about using that caddy, and you're going to get it at home. Also, with certain lab testings, when we talk about growing cultures, specifically with strep, sometimes that rapid strep test is inaccurate. We know that if you ever went to the doctor and you took a test and it came back negative, but you were actually positive. So we're going to start teaching on throat cultures. And so I'm going to send you home with a cotton tip applicator. And then I'm also going to send you home with some Petri dishes. Excuse me. These are Petri dishes. They've already been poured with agar, which is the type of supplement to use to grow bacteria. And what I'm going to get you guys to do is I'm going to get you to swab your throats or your family members, however, and then we're going to watch bacteria grow on these plates. And so I'm going to send these home with you guys. Okay. Also, EKG. So technically, I don't have where we're going to be together, such as learning to place the EKG leads, but you don't necessarily have to know, like actually do it. You just have to have the knowledge of it for testing purposes. So when you go test for your certification, you need to know where to correctly put the EKG leads. And so I have a video that I send out my students all the time, and I'm going to send you actually EKG stickers home with you so that you can actually practice placement, whether it be on you, whether it be on a family member. However, I'm going to send you EKG stickers home, and you're going to be able to practice that. I have a video. This is Charles. I have a video that I always send out to my students, especially during this whole pandemic. I had to send this out, me doing EKGs, because we were not able to do it in the classroom due to COVID-19 and school shutting down. So we're going to practice where to put the leads on the body. And we're even going to talk about how to do it if it was a pediatric patient. So we're going to practice those things as well. again, you're going to get that EKG strip in the mail. So that's everything in that lab kit. Again, make sure you keep up with it, just so that you won't be lost when we get to a certain skill, and it's going to be fun. I'm also going to send you guys some note cards. This is free. I have a whole lot of them, so I want to send you guys some blank index cards. When we start talking about medical terminology or certain terms or even lab values, you're going to need to know that stuff. This is not something that you think that you can just breeze by. You're going to have to actually know what these medical terms are, or when we talk about anatomy and physiology, you're going to have to know what's the structure of the integumentary system, what's the function of the endocrine system, how does it work, and so you need to know all of those things. What is homeostasis? What is the heart regulator? You know, all those different types of things, and so index cards are your best friend. So I want to send these home with you guys as well. So that is everything, I believe. I'm trying to make sure I'm not missing anything. I don't think so. So no. So that's everything in your kit. Again, you're going to be receiving this in the mail. Once you receive this in the mail, make sure you go down. There's going to be a list in here of all the supplies that you need. I need you to check to make sure that all of that is in there. If not, send me an email. And also send me an email once you receive this so I know that you got it, okay? So there it is, folks. That's the lab kit in a nutshell. And again, this is going to be fun. I made sure that you're going to have everything so it can mirror the actual real world experience, okay? So we're going to do that. I think it's going to be very, very great. All right, so until next time or whenever you hear me, I hope you're going to be doing well, staying healthy, staying happy in the midst of all of this. So I'm praying for all of you that God covered us all during all of this and that God will keep us. So, all right, you guys have a great rest of the day, and I will see you when I see you.